In terms of encouraging more people to get the flu shot this fall, will the province be covering the cost of those vaccines for people who normally would have to pay for it? And what about the access to the flu zone vaccine for seniors in BC who don't live in long-term care home? Will the cost for that be covered as well?
So on the latter point, we're receiving 47,000 doses, and those are going to be focused of the flu zone vaccine that'll be focused in long-term care and assisted living. The plan is to continue to make the influenza vaccine available under the same basis before. A number of people, of course, receive those immunizations without cost, and that will continue to happen. And we're hoping to, of course, expand out the percentage of seniors, for example, who use it, and the percentage of everyone over 6 months who's eligible to use the influenza vaccine to see that it happens. So it's going to be a similar plan than before, except there'll be some different ways of distributing because in response to COVID-19, and obviously the high-dose flu zone vaccine will be available in long-term care and assisted living. Perhaps is there anything to just in terms of how we get that?
There are very few people who are not eligible for free flu vaccine, and this year more than ever, we have the availability of vaccine to provide it to them. We know that some workplaces provide it. We know that adults who visit long-term care homes, who have elderly people in their home, have people at risk in their home, who visit any of our healthcare facilities are eligible for the vaccine.
Do you have a follow-up, Tina?
Yes, thank you. Dr. Henry, you mentioned the shortage of testing reagents. How concerned are you that these shortages will mean that we can't meet the target of 20,000 tests per day? And if we could also get the answer in French, please.
Yeah, this is something we're working on, and our provincial public health laboratory, Dr. Cradgen and his team, have been working with our colleagues across the country. So there is an initiative to develop the reagents that we need and the equipment that we need in Canada. Part of it, of course, is the fact that these machines come from other countries, primarily the US and China, and the availability has been a challenge. But we do have a plan, and we're making good progress on that. As a matter of fact, I was on a call yesterday where we were looking at where we've come around being able to access it. So I'm confident that within the few weeks that we'll be able to get where we need to be.
I'm just wondering if there are more concerns this year with potential illness or sickness in people who have unstable housing, who are maybe sleeping on the streets, and whether there will be kind of concerted efforts to get the flu vaccine to them.
Yes, there's been, first of all, an extraordinary effort, and want to acknowledge the work done by medical health officers across the province, by health authorities. It's particularly true in Vancouver Coastal, to ensure that to the maximum extent possible that all people are protected against COVID-19. So you'll see in our plan, it's a very important part of our plan to protect vulnerable communities of all kinds. So that means seniors, of course, and you can see the very significant investment to protect seniors and to support seniors. That includes supports in the community that we've seen and supports in long-term care and everywhere else. See vulnerable communities such as those with chronic diseases who will be receiving, as part of our plan, getting additional supports and supports for primary care, and people who have who are lacking appropriate housing of whatever kind, also receiving support. So all of these are significant parts of the plan that's been put in place, and I think there are obviously profound challenges with the COVID-19 pandemic, of this public health emergency. We know its impact on the other public health emergency, the overdose crisis, and we continue to bring measures forward to address that as well, and we will continue to in the days to come to address that question. But in terms of vulnerable communities, I think the work done by public health care in combination with housing and everyone else in the province has been one of the things and one of the groups of people and one of the efforts that have involved all those communities themselves and public health that I'm most proud of as Minister of Health. I think when we look back at this one day, as I hope we will, their work, the work of people such as Dr. Daly and Dr. Lasician in Vancouver Coastal Health, for example, led by Dr. Henry, I think that work is some of the work that's been the most extraordinary during this period of pandemic.
Heather, just asking for one little thing here first. With immunization, some clarity on if you're not in one of the highest need groups like young kids, elderly, families of them, can you just walk into a pharmacy? Will you be able to walk into a health unit, say you're a healthy 25-year-old, and get your vaccine paid for?
In my ideal world, yes. And I think this year more so than ever, there are very few people who are not around somebody who's at high risk. And so there are very few people who would not be eligible for our publicly funded influenza program here in BC.
If you are going to be getting a flu shot this year.
Absolutely. I have been getting a flu shot every year since I became of a certain age. And I think actually Dr. Henry and I did it together last year. I don't know if your dance card's filled, Dr. Henry, maybe we'll do it again. But absolutely, I fully intend on not only getting an influenza vaccination, but encouraging as many people as possible to join me.